Good morning and welcome to the Virginia Nutrition Security Summit. Thank you for taking the time to join this event as we continue the conversation on food access and nutrition security in Virginia. Thank you to the Federation of Virginia Food Banks for hosting this summit. And thank you to the sponsors, Truist, Centerra, and No Kid Hungry Virginia, for your commitment to helping families and students. Today's focus is on nutrition security and recognition that we cannot solve hunger and food access without addressing affordable housing, access to education, public safety, local emergency services, and healthy environments. Over the past 18 months, COVID-19 has renewed our commitment to ensuring that all Virginians have access to the food they need to grow and thrive. Even as vaccines are opening doors to a new normal, we all carry with us the memories of empty grocery store shelves and worry about whether we or our neighbors had the basic necessities. I am proud to say that we have made our feeding programs a priority during our COVID-19 response. From building shelf-stable food boxes to connecting our Virginia farms to food banks, we have looked for ways to support Virginians. Last year, we launched the Virginia Roadmap to End Hunger, bringing together stakeholders in healthcare, education, agriculture, local communities, social services, public health, philanthropy, economic development, and many more. We have worked together to pass legislation that will support our entire food system, from farmer to consumer, while continuing to build our local economies. Together, we have made great progress to feed more Virginians and take steps to provide families with access to the food and the benefits they need. Thank you for including me today to acknowledge our successes and recommit ourselves to doing more now and in the future. Thank you so much.
Good afternoon, everybody. My name is Heidi Hertz, and I'm the Deputy Secretary of Agriculture and Forestry. I appreciate the opportunity to be here today for the Nutrition Security Summit. I appreciate the Federation of Virginia Food Banks and Eddie Oliver inviting me to be here today, and look forward to hitting the road with everyone to talk a little bit about some of the things that Governor Northam highlighted, and also some of the directions that we hope to be going. I can't think of a better time to be having this conversation than during September, which is Hunger Action Month, and appreciate the commitment from all the attendees today and the work that you do in your communities and throughout Virginia to really end hunger in the Commonwealth. So to get started, one of the opportunities that we feel like we have around food and nutrition is to think about how can we work towards ending hunger, but do it in a collaborative approach. So today, some of the things that I would like to talk with you about are how we are leading the way, how our COVID food program response has continued, celebrate some of our successes, and then also start thinking about how much more there is to do. Before we get started, I am going to make sure that my slides are being shared. I'm having trouble moving them forward on my end. Okay. I think I'm going to pause here, and I am just going to give the remarks. Eddie says that he can see them, so maybe I will give it another go. Thank you. So as we begin, I want to recognize that the Governor's Children's Cabinet has played a big role in the work that we've done throughout the Commonwealth. The Children's Cabinet was established in June of 2018 through Executive Order 11, and Governor Northam insisted that First Lady Mrs. Northam be the chair of the Children's Cabinet. And it brings together the Secretary of Education, Otto Carney, Secretary of Agriculture, Bettina Ring, Secretary of Public Safety and Homeland Security, Brian Moran, Secretary of Health and Human Resources, Dr. Dan Carey, and Lieutenant Governor Fairfax. The purpose of bringing together the Children's Cabinet was to think about how we can address really complex child health issues. And those child health issues had priority areas of school readiness and early childhood development, nutrition and food security, trauma-informed care, and student safety. The goals of the Nutrition and Food Security Work Group were really to make sure that Virginia children have consistent, reliable access to healthy foods. And there's intense collaboration among stakeholders with representatives from a variety of organizations representing healthcare, agriculture, the community sector, education, and many others. And through that collaboration, we've been able to share many best practices, talk about how we can achieve additional outcomes, and work together to prioritize items for the Children's Cabinet and beyond. I want to pause and reflect that because of that connection through the Governor's Children's Cabinet, we have been able to continue relationships and build partners that were not there before. And because of that partnership, because of that trust, we were able to begin our COVID-19 response even before COVID-19 began. If we all remember back in March of 2020, the abrupt stop to the lives that we all knew before. And we knew that we needed to have a coordinated response. What we found was that Virginians, as of March 2020, we knew that they would have an increased need for food assistance. And our partners at the Children's Cabinet were able to quickly begin to work together to alleviate the need. Feeding America estimated that because of COVID-19, 150,000 more Virginians were food insecure. This was up from about 800,000 the year before. So more Virginians needed food assistance. We also, through a partnership between the Virginia Department of Social Services and Virginia Tech, surveyed adults receiving SNAP benefits and found that 81% of those adults reported being food insecure, even with that SNAP benefit. That basically told us that benefits alone were not enough to offset the drastic economic impacts of COVID-19. There was more that we needed to do. We also learned from our partnerships at the food banks was that the food banks were having increased demand and they increased their distribution by 30% during COVID. We also saw that participation in our federal nutrition programs increased. There was over 11% increase in SNAP participation in February 21 compared to February 2019. We also saw an 11% increase in WIC participation during that same time frame. SNAP participation peaked at over 785,000 in July of 2020. So we know that more Virginians were looking and relying on federal benefit programs. Virginia had a united response against COVID-19. Our response included initiatives and programs to assist families, to address issues with school nutrition, to support our emergency assistance providers, and to work on food distribution. A couple of the parts of our united response will have lasting impacts going forward. A couple of those you can see highlighted. The SNAP expansion, for example, during COVID, Congress increased SNAP by 15% using ARPA funding. And what we've recently realized is that USDA has reevaluated the Thrifty Food Plan that's used to set SNAP benefits and increase those benefits for families. This is the first increase since 1975. Another program that was instrumental in our fight against COVID-19 and providing support for families was the pandemic EBT. For those of you who have ever implemented or begun a nutrition program, imagine creating one during a crisis. Pandemic EBT was a collaboration between the Department of Education and Department of Social Services. Over $800 million in nutrition benefits were provided to Virginia families through this program. These benefits were provided to supplement the cost of meals that students missed while schools were out or while they were part-time. This brand new program had an extreme impact on families, but also on providers and also on growers. We're hearing stories of pandemic EBT cards being used at farmers markets across the Commonwealth. We also want to recognize the role that our school nutrition departments have played during our pandemic response. As you can imagine, when schools closed in Virginia on a Friday, that weekend was a really busy one for our frontline school nutrition heroes. By Monday morning, many school nutrition providers were already back in their cafeterias, already back to providing meals for students, but typically in a different format, whether it be grab and go or by delivery. They were there making sure that students were fed. I want to recognize Dr. Sandy Kerwood. She was just honored by Governor Northam for the pandemic response that the Department of Education and all the local school division nutrition departments had. I want to share that while we were doing COVID-19, we did not forget some of the long-lasting impacts that we had hoped from our Children's Cabinet work. The governor mentioned the Virginia Roadmap to End Hunger. The Virginia Roadmap to End Hunger is really our playbook. We're truly on the road with the roadmap. It was launched in October of 2020 and is the first of its kind set of goals and strategies prioritizing food insecurity. Led by the Governor's Children's Cabinet, the Federation of Virginia Food Banks, and Department of Social Services, we also utilize town halls to get feedback on the roadmap and strategies that we should be looking at. The roadmap identifies those greatest opportunities for us to make change. If Dr. Duke Storin, the Commissioner of Social Services, was here today, he would say that we can truly solve this solvable problem. The roadmap emphasizes how we partner together, federal, state, local, to make sure that all Virginians have access to healthy food. The goals of the roadmap are extensive. They touch child nutrition programs in schools and after school and during out of school time. They touch increased support for seniors, improving participation in SNAP and WIC programs, encouraging investments in marginalized communities and alleviating food deserts, improving our connections between the healthcare sector and food insecurity work. A lot of that we'll talk about here today. And then also thinking about how we can be better partners locally to help support our local food system. We want to make sure that we're amplifying public awareness around hunger action activities, and then also supporting community organizing to do at the local level a lot of the work that we're attempting to do at the state level. We charted a path with the roadmap, and it involves sectors that we've never brought together before. I'm so proud of the work of the Children's Cabinet Work Group, the partners that I get to work with every day, and the relationships that we've built to truly begin and continue this work. Working together, we have made significant progress. Over the past few years, we have made a lot of progress in the world of policy, program, and partnership. For school nutrition, we're seeing unprecedented opportunities to expand the community eligibility provision and expand after-school meals. We're also helping to meet the needs of families through implementing broad-based categorical eligibility to expand SNAP and even provide additional support for college students. We're partnering more with local agriculture to do innovative food retail in areas that are food deserts, and also think about how we can support both growers and families who need emergency food assistance through partnerships with farms and food banks. If you were to look at the roadmap today, you may see a bunch of circles or a bunch of opportunities that we've already checked off. I'm really proud of that work. I'm proud of how we've been able to come together, take this document and turn it into an action book for what we do next. We've traveled a lot of roads so far, and there's even more to come. Today, I'm excited to share that we will be uploading and launching the Virginia Roadmap to End Hunger update. This update will document the economic impact as well as our state and federal response to COVID-19. It'll recognize some of the successes that we just recognized here this morning, and it will again recommit us through a path forward to ending food insecurity in the Commonwealth. We have a lot of work to do, but luckily we're not doing it alone. Throughout the agenda today, you will hear from experts and leaders from across the state in multiple sectors who can speak to the partnership, the collaboration, and the impact that we're having. I look forward to the discussion that we have today and really look forward to hearing what comes from the discussion going forward. Before I introduce our next speaker, I want to mention that while the chat feature on your screen may be disabled, the question and answers come directly to us. So please feel free to ask questions, engage with the panelists as you see fit. To bring up our next presenter, I would like to introduce a great friend of mine and no stranger to many of you, Eddie Oliver, who's the Executive Director of the Federation of Virginia Food Banks. I want to recognize the work that his 7 partner food banks have the work that they've done and the work that they continue to do to fight hunger through COVID and beyond. They've been such a strong partner for the Commonwealth and for many of us. So without further ado, I would like to introduce Eddie Oliver.
Good afternoon, everyone. It's great to be with you virtually. We desperately wanted to have this event in person, and we were planning for that right up until the last minute as long as we could. Unfortunately, it didn't work out that way, but we are planning to convene in April of next year, April 19th and 20th. So I'm hoping that you all can hold those dates. There's so much exciting work to be shared in this space of food insecurity, public health, and public policy. And this really isn't any substitute for getting everyone in the same room, making connections, forging new partnerships, sharing information. So please just see this as the start of the conversation, and we hope to engage with many of you in new ways moving forward. So I'm going to pull up my screen here. Hopefully, the technical difficulties is just one example of why we wanted to have this in person if we could. I think everybody has experienced this. Here we go. Everybody see that? Great. Okay, so Heidi shared a lot of the great successes that have happened in the world of food access and food security over the last year since we released the initial roadmap to end hunger. It's been a trying time in a lot of ways. We saw, as Heidi mentioned, huge increases in food insecurity at the beginning of the pandemic. Then we saw the stimulus measures come into place and really saw the power of both the public and the private sector kicking into gear to address food access issues. And so what I want to talk about moving forward, and this presentation really does come at an opportune moment, right, when we have Congress debating some of the biggest transformational measures that we've ever seen when it comes to the social safety net. But really, it's a question of, are we going to maintain a lot of the successes that we have experienced over the last year? And one example of that is summer EBT. As schools closed, and we didn't know how the hundreds of thousands of Virginia kids who rely on free and reduced meals, how they were going to access that critical nutrition, pandemic EBT kicked into place. And it's really a simple premise of just giving families the financial support they need to buy more food for their families. And summer EBT, it's a very similar concept. It's been around for a while, but instead of relying on the traditional, very bureaucratic, very regulated summer food service program, where only certain communities are eligible, you have to come to a site every day. Again, just give those free or reduced students and their families more money to spend at the grocery store and give them the dignity of being able to put food on the table. The child tax credit, which just went into place in July on a monthly basis, has, again, already proven to be transformational for families. USDA, and we document this in the roadmap update, but the USDA did a survey right before and right after the child tax credit went into place, and there was a measurable difference in food security for families with children. And so that's another example of where we can keep making sure that low-income, at-risk families have the resources they need to purchase more food. And again, as we shore up these programs, make them stronger, the emergency food system in the charitable food sector can start to focus in other directions and really start to layer services. And that's what I'm going to speak to a little bit later. CEP expansion, for those who don't know, CEP is just an option that schools can take if they're high need that allow all kids to eat for free. Give resource, really treats meals like the critical educational resource they are. We don't discriminate by who can pay for textbooks or laptops or teachers in a school, and why would we do that for meals? So these first three things here are all options that are currently in the Build Back Better plan that's being debated in Congress right now. And now is really an opportunity for us as a community, those of us who care about food access and food security in Virginia, to let your voices be heard. I included a link here, Feeding America, where you can stay up to date and get action alerts from them. And of course, there's a couple options there on Twitter for those who like to tweet from time to time. You can get additional information, staying in the loop there too. And of course, a lot of this plays into the options that the state has. And we have, as a network of advocates and food access partners, we have made tremendous progress already, so many successes from the Roadmap to End Hunger. And it's really, we're just looking at how can we build on those successes, strengthen them over the long term. Expand and sustaining the Food Access Investment Program, where we can put money into low food access communities, build up the food retail environment, provide jobs. This is really a long-term sustainable action that's going to improve food security and isn't reliant on just the charitable food sector alone. Supporting the child nutrition programs, we want to deepen food access partnerships, maximize program access and awareness. I'll speak to the food access partnerships real quick. It wasn't just the grab and go meals that the school nutrition departments did right away, or even the pandemic EBT, but food banks have expanded our school pantry programs, our backpack programs, and we're continuing to do so in ways that is strategic with the schools, so that we're making sure there aren't any gaps where kids are missing out on access. And then there's a new report that just came out from the Task Force on Culturally Inclusive Meals that I encourage everyone to take a look at, because this is really an equity issue. How can we make sure that all families, regardless of their background, are have access to meals that they like, that they're familiar with, and they shouldn't be forced, to just take whatever food we want to put in front of them. The Fresh Match Network and incentive programs. This summer, we're continuing to see investment and want to see more. We have all kinds of new farmers markets that are offering incentive programs where you can get an additional $1 for every $1 you spend in SNAP benefits. And that really, incentivizes people to choose healthier options with their benefits. And it also supports the local ag community. Investing in healthcare partnerships and produce prescription programs. I think you're all going to see some good activity in this space moving forward at the state level. So again, historic, unprecedented investments in food security during the Northam administration, going back to the McAuliffe administration. And I know a lot of you were involved in that work, and I should be really proud of what we've achieved together. And I think we need to continue to work together to support all this. And those are some additional links at the bottom that you can follow to stay up to date on our advocacy work. So beyond just the policy options, right, we have to look at how can we strengthen collaborative partnerships and align on goals and support information sharing. And I wanted to share some specific ways we're thinking about doing that. So, this right here is an opportunity for us to come together and talk about all the policy options we're working on, our policy priorities, start to build a comprehensive food security agenda. And that's really at the heart of what we were trying to accomplish with the roadmap. And it's the reason why we continue to do updates each year, because we know the policy environment changes and we don't want this to be a static sort of document. The food banks are tackling all kinds of new initiatives in the food sourcing space. And I'm glad to see we have lots of partners in the ag sector who are focused on this as well. Everybody from dairy farmers to local small organic farmers are very focused on how can we get Virginia food to Virginia families, and again, accomplish two things at once by shoring up our food security programs and lifting up folks in the agriculture space, small and minority owned farmers, and supporting our regional food system at the same time. And then health equity, healthcare partnerships, and we're really going to dive into that here in a moment. There's also a lot, we know that in order to accomplish our goals in the collaborative partnership space, we have to be speaking the same language and working from the same playbook. And that means information sharing, getting the data to everyone who needs it, and starting to align on goals. So for those who aren't aware, I really encourage you to go to feedva.org. If you want to bounce over there now, I wouldn't be offended, but please come back. But just check out the website. It has all kinds of cool data. It has a map that you can explore that layers on different programs, different indicators of need. Hunger Action Coalitions are a way that we're starting to operationalize a lot of our work at the local level. You can find more information about that at feedva.org. And if you're interested, we're always looking for more Hunger Action Coalitions across the Commonwealth who are willing to be that sort of backbone support, bring together partners to look at, okay, how are our school meal programs doing? How's our SNAP uptake? Do we have incentive programs? How are we dealing with food deserts in our community? So there's a lot of ways that we need to help drive change from the state level down, and Hunger Action Coalitions are just one way that we're doing that. And then there's the Commonwealth Data Trust, which we're just at the beginning of a project that's going to take a lot of our goals and indicators from the roadmap and package them all together in one place. That's a public, open information forum that everyone can access, and again, better know the extent of our reach for all these programs. So to drive home on the collaborative partnership work, and I really wanted to dive into how we as food banks are starting to think about healthcare partnerships and nutrition security in particular. So I have here a mission statement, which is traditional. I think a lot of you could have guessed the main planks of this: building capacity of our food banks and engaging partners to end hunger in the Commonwealth. But our vision is starting to point us in a little bit of a new direction with a new framing. Our vision is a healthier, food secure Virginia, right? So healthier is central to what we're doing. And another way of thinking about that, and you may have noticed from the title of our event today, the in-person convening that we're planning, but nutrition security is becoming more and more the frame through which we look at our work. And so another way of saying that same thing is our vision, not just a healthier food secure Virginia, but a nutrition secure Virginia. So we really want to be explicit that those who are most likely to suffer from diet-related diseases are also most likely to suffer from systemic inequities and structural racism. And that's a really important thing for us to call out and acknowledge, because it impacts the ways in which we look at our work and how we layer on our partnerships. And it's not just about education and behavior change, because those shift the blame, right, to the marginalized communities and say, oh, there's something wrong with people we're serving, where they just need to be better educated. Well, that's not true. It really is systemic and it's structural. And food banks are part of that system. We're part of the food system. We're part of, for a long time, and in many ways, we've been part of the problem. And so we need to change our solutions if we're going to see any change in the communities that we serve. And so we view nutrition security as partnering to increase access to culturally relevant, nutritious foods and altering the built environment. So again, talking about systems change and the structure to make the healthy choice the easy choice, so that everyone has the right to achieve their full health potential. So again, the framing is important, but it can't just be talk, right? We're starting to operationalize this by developing a strategic plan around health equity. We've convened all 7 food banks across Virginia and have developed an operational definition of health equity. And you'll see some common themes, right? It involves policies, systems, and environments that ensure opportunities for everyone to attain their highest level of health. Again, opportunities, choice, and systems change. Throughout the course of our strategic planning process, these are some of the objectives we're going to pursue. Really, the idea is that whatever community someone is in Virginia, they aren't captive to the resources of that community. And that's often not only do we often work in silos in this space, but even as organizations or individual emergency food providers, we're often only focused on our individual communities. But how can we take a wider lens, go to the 30,000 foot level, and start to look at resource allocation? Is everyone getting what they need? And does everyone have the same opportunities? And that means, to some degree, streamlined service delivery, uniform programs, and information sharing and data systems. So those are some of the ways that we're really trying to integrate this work at the federation level, not just work in parallel streams at the individual food bank level. And if we do our work right, again, we're really early in this process, but the vision at the end is that we're working together like never before to improve the health equity of the neighbors that we serve. So that's just one example of how the food banks through the federation are starting to pursue this work together. But we have to broaden, we're talking to stakeholders from the healthcare space and the public health space. And we're also engaging clients in this work, getting their feedback, those with lived experience, so we can better tailor those programs and have more sustainable solutions at the end. So, sorry, there was a lot of information to throw at you. Hopefully that sets the stage. We have some more concrete, clear examples moving forward. But next, I just want to share a short video that elaborates a little bit on this work and some of our partners in the space, starting with the early investments that Sentara has made in our work.
Food banking really is a dynamic sector in a lot of ways. We've gone from the basic premise of rescuing food that might otherwise go to waste and getting that food to people who need it, to thinking bigger, more holistically about how do we not just feed the line, but actually shorten the line.
It's not just providing a meal for people who need it today, but helping them to be able to feed themselves tomorrow.
And so with us being able to prioritize certain social determinants that our communities pointed out, we have a greater focus and we have an ability to pull together partners and key stakeholders that are going to help us tackle those and hopefully knock them out.
Part of the mission of the Federation is to engage partners to end hunger in the Commonwealth. That's right there in our mission statement. So how can we work in partnership to start to address some of those root cause issues?
There is a role that all of us can play. We work with partners in healthcare, in financial literacy, in housing support, and I think together, all of us bringing our collaborative expertise really can have an impact on the needs in our community.
We all believe in continual learning because times change. We've all seen that over the past 18 months.
Early on in the pandemic last year, we were not seeing the number of corporate volunteers that we typically have, and we were not seeing the number of corporate donations that we typically receive. So that Sentara developed this We Care program. They put together the resources so that we could provide We Care boxes.
We had just seen a huge spike in food insecurity, going from 9% to 22% in just a matter of a few months, huge job losses, and it was really an innovative food delivery system that allowed us to do these low-touch distributions in a safe way. And a year and a half later, we have distributed over 200,000 boxes to people in need. In my career, I have really seen the power of public-private partnerships, and I think We Care is just one example of how that can work.
Our goal is really to trust people who do their best work to do that work. And by building those partners, it allows us to be able to continue to look at ways to meet people in their communities and where they live.
The whole is greater than the sum of its parts. Working together, we can elevate everyone's respective work. At the end of the day, we want to benefit all Virginians.
Looking at health equity and health access and the intersection between food access and health and what we can do to make a difference there. That's what this boundless collaboration is really all about.
So it was a great snapshot of our partnership with Sentara. They did a great job of, we've been working on the Healthy Pantry Network and really our health equity platform here at the Federation. And they pivoted with us during the pandemic. We knew that we needed those food boxes. We really needed to ramp up that operation, and We Care was a great way of doing that. But as we start to move away from those low touch distributions, we're going back to the health equity strategy, the balanced collaboration I spoke to before, and Sentara is right with us again along the way. And want to apologize again about the slides. We will make sure that we send both mine and Heidi's out. I think we were a little overly confident thinking that we'd be able to display those ourselves, but moving forward, everybody else will have those their slides displayed professionally. So hopefully we won't have any more issues. Starting with Sherry Norquist from Sentara, who leads and provides their strategic oversight for the Sentara Cares community engagement, enhances partnerships that build on Sentara's longstanding commitment to creating healthier communities. She works to align and integrate programs enterprise-wide by maintaining existing relationships and identifying external partners and opportunities that support a holistic and strategic prioritization model to address social determinants of health. So ever since I met Sherry, she was talking about, how can we identify some duplication of services and better streamline things and better partner people together across the state to work more effectively. So she's been a great strategic partner in this space, and I'll turn it over to her.
Great. Well, thank you, Eddie, for that introduction and for sharing that video. I think that we can all agree, we hear this word or these words over and over again, community and partnerships. And so in order to not turn that into a buzzword, I'd like to walk through really what our goal is, and our goal has been to make sure that we're not only delivering a certain standard of community services, but first of all, listening to our communities as we build out those partnerships. So if you could go to the next slide, please. So I think, again, I say this, the pandemic, we will probably all agree, had its fair share of negative publicity. When I think about what we did from a healthcare sector and utilizing our partners who do an extreme amount of work in the communities that surround our hospitals and our physician practices, I'd have to say that there was a certain amount of positive energy that came out of those partnerships. Being able to react quickly to needs and being able to bring things to the forefront quickly with the people who could help us make that happen was a positive outcome of the pandemic. And so Sentara is committed to standing up a community engagement department, and our vision really is to improve the health and well-being of all the individuals, along with their quality of life in the communities that we serve. We do this by believing in catalytic philanthropy so that we can create transformative and equitable change. And this really extends just beyond financial donations. So I'm going to talk to you this afternoon a little bit. If you'll go to the next slide, we've heard some information about the opportunity to loop in other leaders. And so from our perspective, we think about our integrated delivery in an integrated network. So from beginning to end, our leadership has been extremely supportive and involved in our work. Whether it is on the grant cycle and decision-making, whether it's volunteering or providing in-kind services. We also have a director of health equity, and she's really leading the charge for us as we look at the places and spaces where we should be going and talking to these community members. We have also our Vice President and Chief Diversity Officer, because when we think about all the details that go into being strategic and building programs, we know that we cannot leave those things out of our planning. And she really leads us down that path and helps us to have community conversations and bring to the table a diverse set of community stakeholders. Our community partners, such as the food bank and such as other partners, including Truist and many others, along with our board committee, help us in this decision process. We want to be good listeners so that when we are making decisions and when we utilize our finances or our team members, that we are listening to our community partners in without that process. And then Sentara has the fortune of working with just about 30,000 team members. And so we are working with our team members to provide opportunities for them to connect with community partners as well. And so you saw the video during our We Care food packing. We came together with Eddie and his team to figure out how would we put all of these things together? You know, how would we assemble all of these low touch boxes so that we could deliver them to our communities and to the partners who help do those distributions. One example of that was really through our testing and our COVID vaccination sites, we were able to offer certain boxes of food to the folks who were coming in there because we wanted to give them an opportunity to not have to go, you know, back into a grocery store if they were pending a test or if they needed to have something to hold them through waiting for those results. So can you go to the next slide for me? So really the purpose here and thinking about tomorrow is really building trust and a lasting hope. So when we talk about mutuality, forging those successful community partnerships, and that always begins with careful and genuine listening. We learn about the needs of our communities through not only active dialogues, but by meeting with our partners. And we have a health needs assessment that we refer to, but together with those details and with the active listening are able to create a positive community impact. Can you go to the next slide, please? So I don't know how familiar that you are with the percent of health outcomes that stem from what we call social determinants. So we know when we started doing this work, even as a health system, that we couldn't do it alone. We really needed to look outside of our hospital walls. 80% of what our communities and individuals in the communities are dealing with are those things outside of the traditional healthcare services. So socioeconomic factors, such things as education, employment, family and social support. Now, obviously, we do know the link between housing and health. And so the physical environment, safe communities, and reliable transportation are part of the details that we want to address in our work. And this last piece, healthy behaviors, and we've talked a lot about this today, is really access to health, substance abuse, and access to other services. So we created a strategic model and very intentionally linked this model together in the form of puzzle pieces, because we know that without one of these things, or the interlocking intersection of all of these things, that people have less chance of being successful. And so you'll see here pointed out specifically the social determinants that Sentara is focused on around housing, food security, jobs, job security, and skilled careers. And then, it goes without saying that behavioral health is on the forefront of all of our minds. We have very particular intentional discussions around how do we solve this together. And all of these things are tackled through the lens of decreasing disparities, utilizing our team members, and driving diversity inclusion when we make decisions related to our strategic pillars. Can you have the next slide, please? So again, just the 5 focus areas where we are engaging with our community partners, they extend past those healthcare services. I mean, we are definitely known for quality in the healthcare sector, but understanding that, and Eddie said this earlier, that a high volume of food in or out of the food bank is good and a measure of success, but what of those foods are healthy foods? And how do we measure the success of those healthy foods being delivered to patients and their families? Not only that, but the next step to that is how do we help people understand the connection between health and food or health and housing? Can you go to the next slide, please? So again, we stood up this We Care program with the Federation of Food Banks, and the benefit to us as a healthcare organization was the footprint that we were able to touch with our work. Again, we didn't do this just from a funding perspective, but we had to think about all the details and planning this over several months. Make sure that the federation was successful and that the individual food banks were successful. So we didn't say, well, okay, here is some dollars to make this happen. We said, how do we make this happen together? And what will make us both most successful and our community successful? And so we took into account not only supplies and location of delivery, but we also had to work with those agencies that were responsible for delivering this food. And so from our perspective, this extended into the senior service agencies that were delivering food and many others as we stood up the solution during the pandemic. So Centerra's been doing this work for quite some time. And as Eddie mentioned, my goal really is from a partnership perspective, how do we connect that back to health? And so through several initiatives, we have what we call the Healthy Food Prescription Programs, where we are looking at chronic disease management, such things as diabetes and cancer. We look at community garden initiatives. We work very closely with our health plan because our health plan, through their case management and outreach, has the bandwidth to touch many people and normally places where we may not be able to connect with them. We also have food drives and volunteer events where we mobilize our many team members who, despite being on the front lines of this pandemic, are still willing and ready to give back to their communities. Can you go to the next slide? Thank you. So the pandemic allowed us to broaden our lens and re-examine the scope of impact. And when I say that the pandemic had a positive impact on us, things and programs like this can take years to change and pivot a model of delivery, but we were able to quickly put this together, looking at national news and having discussions about all the barriers that other food banks were encountering. At one point, we were concerned about where we would get packaging supplies and the cost of packaging supplies. And so we talked about all of those things and how and what would work best for the food banks, and decided on our program and moved forward in that direction. Can you go to the next slide, please? So we didn't want to get more food again just into the hands of the food banks. And we know that now that we better understand the statewide food support network. We continue to talk to our partners and look at ways to scale solutions up. And Centerra does this in many ways, you know, whether it's a free clinic association or a food bank or a heart association. We're looking at the ways that all of us can have a collective impact by working together and utilizing the skills and expertise of each individual organization. So just to mention what our commitment did was really engage with others and have others to join this cause. It oftentimes cannot be done in a silo. We know the importance of collective impact and braided funding. And I will mention here that our friends and our partners who came together with us, and you'll see this in a minute, really showed up at these events. And so again, I have to say, thanks to the good work of the leadership in the organizations and the commitment of the individuals and team members in those organizations, we were able to come together and support our communities when they needed it most. And so to date, roughly 200,000 20-pound 5-day food of those food boxes were distributed. It was important for us to think about not just 1 day or two, because we all know that if you're waiting for some type of test to come back, you may not be able to get out, or we would strongly recommend from a safety perspective that you remain in quarantine or separated, socially distanced from others. And so we also provided, as part of our initiative, resources for people. So when they were able to get into these food boxes, they could tap into some of the other emergency funding and or connection to other services. So you can see in detail on this particular slide, the 7 to 10 bullets that we provided, because oftentimes there are resources there, but people don't always know how to connect with them. And we felt like that was extremely important during this time. So we were so thankful that during this time we had the support and we were able to come out of our traditional healthcare walls and work with the state of Virginia. Incredibly thankful for the governor and his team. They came alongside of us, listened to us as community members, and helped us through the support of the ReCare packages. And as you can see, we continue to do this work together in hopes that one day we will be moving towards less food deserts and providing all Virginians with healthy food, and not only healthy food, but again, I'll direct your attention back to the other places where we know we have to invest some time and energy. Next slide. So what's next? You know, I always think about once we have the opportunity to strengthen our partner networks, how do we expand that out and continue to spread those successful stories out into other organizations? We are working with Unite Virginia to look at how social determinant referrals can span the network of smaller community-based organizations and healthcare networks. This platform allows for us to look at data and to see what types of social determinants are individuals receiving in their communities. And so Sentara is currently using the Unite Us platform in several of our markets and working with Unite Virginia to help other organizations gain access to the network so that we can learn from the individuals who are receiving these critical services what other things we need to invest in and how we need to invest in them. We're also learning as part of some educational opportunities. Sentara is going to be working with Disparity Solutions Center and coming up with a way, again, measuring these things is critically important because we know that we want to have a sustainable future. And in order to do that, we have to be able to learn from the things that we're implementing and how to measure them best. We also connect with partners and with Norfolk State, EBMS, and ODU, standing up a school of public health so that future catastrophic events such as pandemics can be tackled quickly, and that we have a venue in which to learn from those professionals who are doing this work to help guide our path as we work together in our communities. And lastly, we have been supporting grassroots efforts through some Healthier Communities funds and grants. And so we have been partnering and learning all across the state about the things that our nonprofit partners are dealing with and bringing them together with other nonprofits and working to support them in their efforts, as we have done with the food bank. So I'm going to go ahead and turn it back over to Megan and look forward to any questions that you might have in the Q&A.
Thank you, Sherry, for that insightful presentation and for being such a strong partner and thought leader in our nutrition security work. So I'm Megan Butler. I am the Health Equity Project Manager for the Federation of Virginia Food Banks. As Eddie shared earlier, when we're working toward achieving nutrition security, we know that it's not enough to just provide nutrition education in hopes of changing individual behavior, but we really need to focus on shifting policies, systems, and environments that make it easier for all Virginians to access and consume healthy, culturally relevant foods. Programs like our network's Healthy Pantry program work to increase the availability of healthy foods and good quality produce, and do so in a way that is convenient and dignified for our neighbors. Let's hear from Linda, a retired school teacher, about her experience utilizing this program, and from the program's coordinator, Terry Zerflu, from the Food Bank of Southeastern Virginia and the Eastern Shore.
Well, I'm Terry Zerflu, and I'm the Regional Outreach Coordinator for Western Tidewaters branch of the Food Bank here in Franklin, Virginia. And one of the programs that I am lucky enough to be part of managing is our Healthy Food Pantry, and it is a really unique program. So what makes it distinct is what I just love about it is its client choice, meaning every client comes in and they get to pick what they want. And the Healthy Food Pantry program is for folks who have health conditions that can be solved or resolved some with healthy food.
Well, it has helped my food dollar quite a bit because going to the grocery store for fresh fruit and fresh vegetables is quite expensive. And coming here to get it free, I mean, that's a game changer. That does a lot for my budget now that I'm retired. It helps a lot.
Healthy Food Pantry provides the clients with dignity in shopping because they get to choose.
Even though I may not be able to afford to go and pick up what I want, I'm made to feel like it's okay. We have it for you, and you are welcome to it, and you are important.
I also think that it allows people to access this beautiful produce that, quite frankly, for some of them is out of reach financially. When I can provide them a green pepper that costs $2 at the store, they're thrilled.
You don't feel like you come in here because you're poor. We're just doing this because we don't have anything else to do. It's like, you're welcome, come in. We've something that you can use, and we'd like to help you with our service.
We know in Franklin and Southampton County is a very large food desert. And without services like Healthy Food Pantry, the folks like Linda and other clients who participate with us would be shopping at Quickie Marts, at Walmart with limited dollars and skipping those beautiful produce items. They've told us that. So the fact that they can access this produce, this level of quality of product, is game-changing for Franklin and Southampton County. It's a big change for our community to have access to this. We just need more people to know about us.
I just feel welcome. I feel like somebody wants to help me. And that's a good feeling. It really is.
Linda's story is unique, but not unlike many other stories experienced by our neighbors in Virginia. The model of food banking has come a long way in recent years, from a focus on pounds of food distributed to a more holistic focus on the entire neighbor experience and quality of food offered. And still, we've got work to do to ensure that all neighbors, like Linda, have a dignified experience accessing the foods needed to nourish themselves, their households, through our pantry doors and beyond. And with that, I'd like to introduce our next speaker. Dr. Michelle Hess is a registered dietitian and assistant professor in the Department of Health Professions Dietetics program at James Madison University. Her scholarly interests include evaluating the nutritional quality of foods in food banking systems. With a multidisciplinary group of stakeholders, she developed Nourish, the cloud-based platform used by Blue Ridge Area Food Bank to enable them to make informed procurement decisions based on nutritional quality. From 2018 to 2020, Michelle served as a director of agency relations and programs at Blue Ridge. There, she worked with food bank staff and pantry and program partners to ensure that vulnerable populations had access to enough nutritious foods. Michelle continues to provide consulting services for Blue Ridge on various health and nutrition initiatives and currently serves on JMU's Basic Needs Advisory Board, as well as the Federation of Virginia Food Banks Health Equity Working Group. Today, Michelle will be providing insights into Blue Ridge's food pharmacy program and some key learnings from their innovative partnerships with both UVA Kidney Center and Augusta Health.
Thank you so much, Megan, for the opportunity to share a little bit more about Blue Ridge Area Food Bank's food pharmacy program and how, through cultivating strong relationships with healthcare partners, we aim to improve the quality of health and life for our vulnerable neighbors. Next slide, please, Kara. In recent years, food banks have been challenged to think about their contributions to the health and well-being of the communities they serve. And goals like Healthy People that are set every 10 years by the CDC help to provide some context on how food banks fit into the health equation. One of the latest goals that are focused on health equity from Healthy People states that we as a society need to be holistic at creating social, physical, and economic environments that promote attaining the full potential for health and well-being for all. And as we think about food banks as partners in promoting and helping all of our neighbors attain their full health potential, we need to bring some attention to how food banks operate. So for those of you who are on today's webinar who are not familiar with how food banks work, food banks are a hub for food acquisition and distribution. So essentially, we're acquiring food from local, regional, and national sources, and then we distribute through hundreds of community organizations, or what we call partner agencies, throughout the region. And at Blue Ridge, our service area covers 25 counties and 8 cities in the central and western part of the state. Food banks across the Commonwealth could not do our work without the support of the communities in which we operate. And many of our partners who help us distribute food are co-located in their communities where people are living, working, playing, and growing. And traditionally, these spaces have included neighborhood pantries, churches, shelters, schools, and senior centers. We know our programs have been pretty successful at providing neighbors with enough food, but over the past few decades, evidence has really surfaced that connects food quality to the impacts on health outcomes and health disparities among our food insecure neighbors. And that really speaks to the question of what about the quality of the food that we are providing to our neighbors? These data have really helped us reframe the scope of how we view our work and have presented some new opportunities for partnerships to reach people where they go to get well. Next slide, please, Kara. At Blue Ridge, we are focused on helping our neighbors achieve their full health potential by leaning into nutrition security. And I know we've used that term a few times today. And I just want to underscore that nutrition security acknowledges that food alone isn't enough. And it is inclusive of access to high quality nutritious foods that meet social, circumstantial, and cultural needs. So for example, for food to be socially acceptable, people should have a choice in the foods that they select. And as you saw in the video previously, pantries around the country are operating food choice models where individuals can go in and have the freedom to choose what foods fit their food ways and make those choices for themselves. Nutrition security should also be attainable for different household circumstances. So for example, a single head of household parent that works multiple jobs still should be able to provide a nutritious meal for their family. And for our neighbors who follow unique cultural foodways, they should not have to sacrifice their cultural values and norms because of food insecurity. And at Blue Ridge, we've worked with many immigrant and refugee organizations to better understand how our sourcing practices need to be shifted to help these neighbors meet their food needs. And we really hope by helping our neighbors achieve nutrition security that we in turn are reducing their risk for future health burdens. We also know that right now, millions of Americans suffer from chronic illnesses like diabetes and heart disease. And in a study conducted by Feeding America, up to 60% of households that access food pantries report having one family member with diabetes or hypertension. And this is much higher than what we see in the general population. And when we think about the nutritional security needs of these neighbors, we must also consider how the food we provide impacts their ability to manage their blood sugar, or how are they managing their hypertension? And this really speaks to the quality of their life. We as food banks can secure nutritious foods, and we also need to recognize our limitations. We are not healthcare providers. So this is the reason why we work together with healthcare partners and they have similar questions too for their patients. We've worked really hard over the last few years to grow relationships with the University of Virginia Kidney Center and Augusta Health, and have established food pharmacy programs together that really focus on placing the needs of the patient at the center of our work. I also want to acknowledge that this work would not have been possible without the generous donations of our Sentara Foundation partner. Next slide, please, Kara. Thank you. So I'm going to talk and describe a little bit about how we work together with our partners. And in this example, I'm going to focus on our relationship with University of Virginia Kidney Center. So how we got started was through a connection with a local champion, a dietitian at the hospital who was well known to those at the Federation of Virginia Food Banks. And that individual was connected with Blue Ridge staff, and other dietitians who were part of the Kidney Center joined our initial conversations too. They really helped us understand the unique nutrition-related challenges that dialysis patients face every day, including the need to have a diet limited in certain nutrients, and that kidney patients are exhausted after receiving dialysis treatments 2 to 3 times a week, which really impacts their ability to prepare foods. UVA administration was also really enthusiastic for this program, given the direct benefits to the patient and as a value-added service aimed at increasing patient satisfaction. We also included patients of the center in the process of developing the program. They helped to provide feedback through the clinic dietitian to the food bank on their needs and circumstances. And in April 2020, the first bags of food were given to patients and continue through today, with a recent expansion of another Kidney Center food pharmacy program in Orange, Virginia. So on this slide here, I show a model for how we work together in this program, and I'm just going to quickly walk you through this. So if we start at the yellow circle there of how we get food, the dietitian selects and orders food specifically from the food bank through their online inventory, and this also required us to change some of our purchasing practices for the program and make sure that we were providing foods that were kidney friendly and that were aligning with the nutrition support that the dietitians were recommending in their clinics. The food bank then delivers the food directly to the clinic, and that food is unpacked by volunteers and stored on the shelves in the Kidney Center. Moving to that orange circle, how we connect with patients, the dietetic team or the team of dietitians at the clinic screen patients for food insecurity each time they come into the clinic or weekly, and refers any patients who screen positive for food insecurity to the food pharmacy program. Those patients receive supplemental food as often as they need, up to 1 time per week. And those bags of food are packed directly by the Kidney Center staff and delivered to the patient during their treatment. Patients typically spend about 3 to 4 hours at the Kidney Center. So this was an ideal opportunity to be able to provide food to patients while they're going through their dialysis treatment. One of the last pieces that I want to emphasize is how we get better. And I think that this is a really important aspect of these collaborative models, is that this is an iterative process and this is new and innovative work. And we're really learning together as we go along. And so not being afraid to ask questions or not being afraid to raise the questions that we may be hesitant to ask. It's also important that we have a constant feedback loop and that the program feedback is shared not only with the providers, but also the patients with the food bank staff, so we can understand how to make improvements on our end to the services that we're providing to our neighbors in need. And of course, that collaboration and the communication ensures that we are a good team, and also ensuring that we are keeping the patient at the focal point of our work together. Next slide, please, Kara. So my closing remarks is there really is enough room for everyone at the table in this work, and many hands and perspectives are necessary to ensure that each individual can reach their full health potential. So if you're in the room right now, the Zoom room, thinking about wanting to establish a food pharmacy partnership, I'm going to share a few tips. So for the food banks and food pantries that might be in the room, We encourage you to start networking and really identify who your community champions and navigators within healthcare institutions are. And they can really help you get started, even if it's just an initial conversation and they begin to connect you to other people in their hospital. The other thing that's important to understand is establish an understanding of what is valued by the healthcare partners in this work. That can help you to frame conversations. For healthcare providers in the room, start conversations about how your hospital's community health needs assessment aligns with food and nutrition security, and then reach out to your local regional food bank to help spark a relationship. For foundations and businesses, consider how to align your future funding opportunities and resources to seed and support food pharmacy partnerships and work in your regions. And for our legislators who are here today, please visit your local food pantry or food pharmacy program to see firsthand how programs can have an impact on the life and health of patients, and also understand where these programs may fall short. We need to make sure we're staying focused on protecting SNAP and WIC, which provides necessary resources that the Charitable Food Network just cannot provide. And these programs also help to leave room for choice, dignity, and access for Virginians to source the foods they need to live a healthy and productive life. This work is really transformative, and I thank you all so much for your commitments for being here. And when we work together, we work better. I really hope that this information was helpful to you and your organization as you consider food pharmacy programs as an opportunity to support the health and well-being of our neighbors and communities. Thank you.
Thank you, Michelle. Love hearing about the on-the-ground work and really inspiring partnerships that you all have developed. For the last portion of our agenda today, we have an all-star panel of experts from both Virginia and across the country, starting with Colleen Zubik, who's the Director of Health Strategies for Share Our Strength. She's based in Colorado, has over 15 years of strategy development, advocacy, and intervention, supporting positive social impacts. And over 8 years has focused on the acceleration of food access and food security for communities across Colorado. She was the director of No Kid Hungry Colorado for many years, which was the same position I had as as the director of No Kid Hungry Virginia. And so after Colleen gives a short presentation on some of the more exciting and innovative policies at the intersection of food security and health, we're going to bring in a panel. And I'll introduce them quickly so they can just come in at the end of Colleen's presentation. We have Kelly Cannon, who's the Senior Director for the VHHA Foundation and previously served as Director of State Advocacy for Virginia Hospital and Healthcare Association. She oversees VHHA's work with its members to adjust demographic and socioeconomic factors that impact healthcare outcomes and costs, focusing on addressing health disparities and social determinants of health. We also have Eric Bean, who's the Vice President of Regulatory and Government Affairs at Unite Us, a technology, which I hope many of you have heard of at this point, a technology company that builds coordinated care networks of health and social service providers. Prior to that, Eric was the Secretary of Health and Human Services in Rhode Island, where he prioritized improving access to healthcare, controlling costs, and addressing the addiction and overdose crisis. And last but not least, we have Dr. Vanessa Walker Harris, who's the Deputy Secretary of Health and Human Resources in Governor Northam's office. In this role, she ensures access to high-quality medical and behavioral health care in partnership with DMAS, Behavioral Health and Development Services, and other health professions. Prior to her appointment, she served as the Director of the Office of Family Health Services at the Virginia Department of Health, where I had the opportunity to work with her a bit on CACFP and SFSP access. So really great to have this panel, and Colleen, I'll let you take it from here.
Great. Thank you so much, Eddie and Megan and team and all the panelists and participants for hearing about so many exciting policy and practices in Virginia, leading the way to addressing food security as a social determinant of health. And so I'm delighted to open this panel with a broader representation of state opportunities to address food insecurity as a social determinant of health. And I'm going to quickly share my screen. pardon me. Okay, so hopefully everyone can see that. Just again, just to echo Eddie's introductions, that this panel has a few goals that I'd like to mention, just to share examples of state level policies in other states, and then also to understand more about the existing policy practices and plans to make the greatest impact on food insecurity. And we'll be turning to our wonderful panelists for that. And then quickly addressing how might we as a community of advocates continue to support this work. Options for addressing food insecurity as the social determinants of health are rapidly expanding and well beyond foundation initiatives. What comes to mind are some of the efforts towards single platform benefits enrollments. We've got the PEAK program in Colorado, the MyBridges, spelled MI, of course, in Michigan, that is a combination of health, food, SNAP and WIC, cash assistance, plus care navigation. We have the North Carolina Care 360, and loss of expertise on this panel. So we'll be circling back on some of those platforms or shared technology to improve food access in social determinants of health, but other things as well. Washington State is joining California and Massachusetts in its efforts to integrate other nutrition vouchers into the EBT platforms. There are ballot measures, beverage taxes, and legislative appropriations. These are all tools at the state level. But given our limited time today, I really wanted to focus in on what I think is one of the largest opportunities for addressing food insecurity as a social determinant of health. And that's really taking a look at state Medicaid options to address social determinants of health. And the reasons for this, why focus here, is because Medicaid and CHIP provide health coverage to over 76 million, of which about 2/3 or a little bit more than 48 million are covered by managed care organizations or managed care plans. And there is tremendous flexibility within those plans that people, states and advocates and managed care plans are starting to use to address food insecurity. And I wanted to really elevate some of those because they are emerging practices, they are changing practices, and I think there's quite a bit of additional opportunity there. Already, states are leveraging managed care contracts to promote strategies to address social drivers of health. 3/4 of managed care states require managed care plans to screen for social needs and to provide enrollees with referral to social services. So that's already very widespread, but there are some additional activity primarily around waivers, non-traditional services, and managed care quality are aspects that are really emerging as a way to support food insecurity interventions and finding a way to have healthcare pay for social care as well. And this is critical, of course, to addressing health equity in all of our communities. So these will be just the 3 things that I'll touch on in terms of what is the mechanism that might be leveraged, as well as how are some states already doing this. Okay, just to start with waivers. Waivers are quite well known, and the section, there's more than section 1115, but just for time's sake, just going to focus on 1115 Medicaid demonstration waivers. They provide states an avenue to test new approaches in Medicaid that differ from what is allowed by federal statute. In other words, opportunity to pay for social care in addition to medical or clinical care. And North Carolina is probably not a new example to this crowd, but their Healthy Opportunities pilots is certainly one of the earliest and one of the more robust in terms of covering non-medical services that address specific social needs linked to health and health outcomes. They too implement standardized screening questions to assess enrollees' non-medical needs. But one of the things that's implemented across their plan, their system here, is that this has to be done within 90 days of an enrollee. And there's a lot of accountability for not only the screening, but then they have built a statewide tool called NC Care 360 that then provides the opportunity to do community resources, track and monitor referrals. So they're really providing some closed loop referrals as part of that screening. And the participation in the statewide tool is really impressive. And this has also allowed them to enhance case management and to do other things, to do enhanced nutrition supports, but always in relationship to medical conditions. But for example, including healthy food boxes for rural adults with diabetes, travel vouchers to food banks are some of those types of things. And that's something worth celebrating, because in the federal statute for Medicaid, of course, providing food is not allowable. So this is really a great example of how they've been able to expand access to nutrition supports by using Medicaid through the waiver process. And of course, I don't know if I already mentioned it, but they also do quite a bit to support enrolling people who are eligible in both SNAP and WIC. And on the right of the screen, you see just the structure that they put in place. I think it's a really well thought out program. And so I thought it might be helpful to see the structure. And I don't know if I need to get rid of everybody's faces here so people can see this. Hopefully that's a little bit better. Okay, but moving expeditiously along, the other one that I just wanted to briefly touch on as well, probably also well known, is California's waiver efforts, both in 2016 and most recently in 2021. And California instituted in 2016 a whole person care model. This is a model that many other states use as well. And the pilot really aimed to coordinate care with vulnerable populations. And in that first waiver, really allowed for added benefits, mostly around housing, but also medically tailored meals and enrollment services. So care coordination to help people enroll in benefits, including SNAP or CalFresh. In 2021, with the second waiver, California really was able to expand access to nutrition supports. And it's a much broader spectrum now that includes, and this will start in 2022, that includes referrals to resources, pantry, SNAP WIC, produce prescription, food pharmacy, wraparound services like nutrition education. And this is really one of the widest or more expanded access. And so I wanted to mention it here. The key thing about this is that the 1115 waivers include a public comment period. And so one of the things that California has done in relationship to this very successfully is advocate to broaden nutrition supports in their waiver proposal. And so there's a group called SPUR of lots of nutrition advocates, different groups that came together and really did a lot of advocacy to ensure that this expanded access was successful. And so that's something I think to keep in mind, that things are flexible. There's opportunities to move things along. Additionally, other states such as Pennsylvania, Florida, Massachusetts, all are model states to look at in terms of using their 1115 waivers to increase access to nutrition. But I want to move relatively quickly. So I'm mentioning hopefully things that will spur people's ideas about things to share at the panel, or encourage people to do some additional research as well. So there's another benefit of working with managed care systems or plans because of the capitated payment system. So not a fee for service, but the value-based capitated allotment provides for some additional flexibility with non-traditional services. And I wanted to give some examples of those. So in lieu of services can be covered by health plans, and they count towards that larger capitation rate setting, and they are not considered administrative services. So essentially it's a way that if people included expanded nutrition supports, they could be brought in underneath the capitation rate. And so New York has done some in lieu of services. Medically tailored meals can be substituted for personal care aid. Again, food not normally being covered by Medicaid. Massachusetts has an extensive flexible services program that allows for a broad range of health-related nutrition supports. And Oregon has a very, I'd say, sophisticated model of moving towards coordinated care organizations. And this was in part 1115 waiver for them that set up these care organizations. And these care organizations integrate a global payment that allows for flexibility to offer health-related services. And they, as a result, they have some of the most flexibility that includes food vouchers, meal delivery, if it's a rural area or an area that the USDA might consider like a food desert, putting in food access through farmers market, and including coaching and nutrition education too, are all things available there. And then just as a reminder, these are things I'm sure that people already know, but value-added services are plan services that aren't included in the capitation rate, but they count towards lots of other points in addressing some of the Medicaid strategy plans. So some examples in North Carolina, you can see these are related to nutrition supports. SNAP eligible members receive nutrition counseling and are eligible to receive a $40 a month produce vouchers. And again, this is just part of that managed care, rolled into part of the managed care payment for that. So keeping these things in mind, I think, can help us all think about, how can we work, knowing that these opportunities exist, how can we work to do more to advocate for extended nutrition supports? And then the third, just super quickly, is leveraging the managed care quality requirements. So every state has a quality strategy, of which you all know, of course, and it's the state's public-facing roadmap for improving quality and access to care. But state agencies and Medicaid often work together on this, and it really drives the procurement process. And what managed care plans or what plans have to then address in their proposals to win those contracts. And so here are just some examples of states that are setting some strategy that then really helps to reinforce and create room in their plans for addressing food insecurity and diet-related disease through greater nutrition supports. So Louisiana has a healthier people, healthier communities, but it includes obesity prevention and healthy development and wellness. I'm not going to read all of them in the interest of time, but you can see this. I want to call out Texas. You can see they have some general things, but then they really drill down in terms of goals and then performance improvement plans and those strategies. So Texas is an example. The quality strategy in Texas at the broadest level is optimal health at every stage, but they really focus in on some of their goals on maternal health, where nutrition access is a key component. And then one of their performance improvement plans is the weight assessment and counseling for nutrition and physical activity for children and adolescents. And so there's a quality strategy, and for every quality strategy, there is also quality assessment and performance improvement. And these are projects necessary to realize the quality strategy. And I think we have some big opportunities coming up. So the CMS has set measures for children and adults in Medicaid and CHIP. I'm just speaking to the child core set here, but these are going to be mandatory for state reporting. And so you can see I've just pulled out 3: weight assessment and counseling for nutrition and physical activity, maternal and perinatal health, child and adolescent wellness. These are all areas where nutrition and access, addressing food insecurity can help states make beneficial improvements here. And that's important because already states like New Mexico and Texas have, if there's certain target measures that they have to make on the weight assessment and counseling. And if they are able to make those measures, then they receive additional funds up to 2 or 3% of their capitated payment, or they sustain financial penalties. So there's a real carrot and stick. So these are just some of the things to kind of think about in terms of where opportunities might still be and where there could be more thinking around solutions to address food insecurity as a social determinant of health. And so now I'm really excited to turn to our phenomenal panel to take a deeper and more local view. And I'm going to stop sharing my screen so that we can see all of them. So I'd like to start with Kelly Cannon. Kelly, could you tell us about Partnering for a Healthy Virginia? Maybe say a little bit about what was the catalyst and what are some of the successes to date?
Sure. Thank you, Colleen. Can you hear me? Just want to confirm. Wonderful. Hi, everyone. Good afternoon. My name is Kelly Cannon with the VHHA Foundation. I'm excited to share a little more about Partnering for a Healthy Virginia with you all today. Hopefully it's familiar to some. In 2018, so we're going to put ourselves in the Wayback Machine, prior to the pandemic, VHHA and VDH inked a formal partnership to address and coordinate population health efforts. What we wanted to do is bring together a multi-stakeholder statewide population health committee to prioritize and develop strategies. We wanted to, number one, improve Virginia's rankings on population health metrics, and number two, to address determinants that impact healthcare costs, health, and well-being and outcomes. So what we've done is create an advisory council that includes leaders from hospitals, health districts, state agency leaders within HHR, as well as other state partners, localities, community-based organizations, including the Federation, FQHCs, free clinics, and other medical and social care providers. What we've tried to do is identify key strategies to combat cultural, economic, geographic, and racial health disparities, and then leverage data and analytics tools that are coming from the state, from VHHA's own data and analytics department, and from our partners as well. When it comes to our successes, one great success that I know Eric will talk more about today, and we've heard of it about this, is the launch of the Unite Virginia Network. So one of the first committees that PHV formed was called our e-referral committee, which some of you on the meeting today are members of. And this group was charged with two primary objectives. The first was to identify a statewide bidirectional e-referral platform. We wanted to figure out a way to better connect healthcare providers and social care providers. So we were thrilled to work with Commissioner Oliver, Secretary Carey, and Governor Northam to secure CARES Act funds in order to bring the Unite Virginia Network to life officially. It launched in December of 2020, and we're charging ahead now. The second objective of the e-referral committee was to identify a standardized screening tool to address social determinants. What we found was that our partners throughout the state were using various screening tools, some homegrown, some endorsed by their electronic medical records or other national tools. But what the committee determined and what the advisory council recommended was that if we could really hone in on one standardized tool, we could both increase efficiency for the screeners and for the referral partners. I've worked at a CBO, and referrals where if someone called, you didn't let them off the phone until you got all the information that you could. So being able to standardize what information was coming in to those referral partners was critical. We also found that this committee is now working on training to ensure that these screenings are conducted in a trauma-informed manner, so in an effective way that puts the clients and the patients first. And we're working hard to meet their objectives and not just the objectives of the healthcare organizations. That's a good summary.
Well, thank you, Kelly. You've kicked us off with a ton of ideas, and I'd like to follow up on one of them. Your mention of all sort of different programs as well as standardization. I'd like to ask you, Dr. Walker-Harris, Vanessa, with a lot of social needs that are addressed in multiple programs across multiple agencies. So how might state government work better to break down silos for the benefit of providers and families?
Sure. Thank you so much for the question and for the opportunity to join you today. Definitely, the work that Partnering for a Healthy Virginia serves as a great model of interagency, cross-sector, multi-stakeholder efforts to address social determinants for the shared populations where we're generally reaching out, touching, working with the same populations. And so it does behoove us to figure out how to do that better and in a more coordinated and collaborative fashion. So along with Partnering for a Healthy Virginia, the Children's Cabinet, which Deputy Secretary Heidi Hertz elevated, is another example of that. It's key to have that leadership support from the top that promotes the necessary collaboration across state agencies. And then not forgetting our community partners. Oftentimes, those folks who are closest to the problem are closest to the solution. And so making sure that we're drawing from their lived experience in order to develop systems that will actually work for communities. And so we're doing a lot of that work, which I think will further be fostered by the One Virginia charge that has been set out to all state agencies, which is to have a health equity framework and lens to make sure that our agencies internally are inclusive, and then the services that we're providing to the community are also done in a way that does not further entrench disparities, but actually addresses them and gets at those root causes, these social needs and social determinants that we're discussing.
Great, thank you. Thank you very much. I want to circle over to you, Eric. We heard a little bit about Vanessa speaking to some of the challenges or things necessary around broad-based collaboration. She mentioned leadership, among other things. And you, of course, are working on the Unite Virginia Network. And so how are you using technology to change the conversation around addressing social determinants of health? And if you could speak to it as a collaboration tool as well.
Absolutely. I think the role of technology is to help translate the broad policy vision into a reality. As Vanessa was saying, what we see in government too often is agencies operating in silos, looking at one slice of an individual's life, one need that they may face, but the whole of government And not just the whole of government, but government and community-based organizations and hospital systems and the plans all need to work together in a coordinated fashion if we want to see better results. And that's what a referral platform like Unite Us does, the one that we're building, Unite Virginia, is enabled that true collaboration, so that if you have an individual provider or organization that's serving a client or a member or a patient, they can screen for social needs, and they're empowered to make a referral with the ability to know that somebody's actually going to be on the other end, meeting that need, reporting on that outcome, and closing that loop. That's really important work that hasn't been done until very recently. And so, just to pick up on a theme that I heard a lot about, health equity, it's reached crisis proportions, and I think it's very revealing that when Governor Northam and Secretary Kerry and Commissioner Oliver and Storin announced this new initiative last year, they all mentioned it in the context of their effort to create a more equitable Commonwealth. When you have a coordinated care network that is diagnosing these needs and putting some numbers behind it, quantifying where there are gaps, it helps you decide where you need to pinpoint your resources, where policy needs to maintain its focus and attention. So it allows the people involved in nutrition security not only to make the case for more resources where it's needed, but also helps them to collaborate when they're identifying co-occurring needs, which we see all the time. Just in Virginia alone, we know that there are income security needs, there's utility assistance, and I think the number one in Virginia is actually housing and shelter. So when an organization like a food bank is serving somebody, they can identify those needs and then help find a partner in the community to meet the other needs they've diagnosed.
Great, thank you very much. So I want to piggyback on working together, something you brought up, and finding that partner in the community. And Kelly, maybe it turned to you about your thoughts about how can the public and private sector work better together to address social determinants of health in Virginia.
Sure. Well, we have heard so many great examples today of public-private partnerships in the nutrition security world. I feel like that question was well answered by some of my friends and colleagues earlier. One thing I think is important is that these policies the importance of addressing social determinants, this is familiar concept to everyone who's attending today's summit, but in general, that's a fairly new concept to the majority of Virginians. And I would say more specifically to the majority of the Virginia state legislature until recent years. I think a key responsibility of the Commonwealth is agility, being open to opportunities, and it's about more than just investments. So I worked side by side with many of you all here for years to address what ultimately was called the Virginia Food Access Investment Program and Fund. Started as our grocery investment funds, and it was a scrappy team of advocates who pounded the halls of the General Assembly talking about food insecurity and met with a lot of blank stares. But like Sherry said earlier, and finally, what we were successful in 2020 to get some state investment in that program is continuing. But one thing Sherry said earlier that resonated with me is finding a silver lining in the pandemic. When you have a front row seat at the worst of the worst, you're looking for some good to come out of this. And I think the good is that growing public awareness and acknowledgement of health inequities. When public school divisions went virtual, it became clear that food distribution is a primary objective of our educators. So it made food insecurity become a common household term, something that folks had not thought about before. So I think we have to capitalize on that. We also found for the first time that causal relationship, addressing social determinants, improves health outcomes. Within VHHA, we have data, we've been collecting data for years about the use of Z codes, which is healthcare coding that indicates certain diagnoses like food insecurity, housing challenges, transportation challenges. These are things that kind of get tucked into the electronic medical record, and later on, maybe we can talk about getting some reimbursement for addressing those. But what we found was that even in the past year, healthcare providers are having conversations with their patients about their ability to safely quarantine, their ability to access food and transportation. When we see an increase in utilization of those funds, it brings us back to the need for gap analysis, which is what Eric talked about, where if we can bring together state partners, philanthropy, healthcare providers, community-based providers, and together coordinate that analysis of the needs of certain communities, we can better direct resources, and funding in order to address those challenges.
Right. I want to open it up to the other panelists as well. Are there any additional comments that people would like to make around the current limitations around data or what improvements need to be made? I think it's been touched on, but I just want to make sure everyone has the opportunity to say more about that. Okay, I'm going to switch gears then to something that Kelly also just mentioned in terms of funding and resources. So this is for anyone on the panel. How do existing budget cycles impact public health and social care? What would it take to shift the focus from short-term return on investment to sustainable cost reduction over time? Of course, this is the million-dollar question, right?
I can take the first crack at that, and then, oh, I'm sorry, go ahead, Vanessa.
You're fine, Eric, please go.
All right, yeah, I'll answer that first and pick up on something that you mentioned, Colleen, when you were pointing to what some Medicaid programs around the country are doing, including North Carolina, the neighbor to the south. You mentioned NC Care 360. That's an initiative that we're supporting there as well. And I think that's a good place to look for ways to identify new sustainable funding streams to support nutrition security. There's a lot of work happening in Medicaid programs around the country, around mandatory screening, around coverage of services that haven't traditionally been covered, things like medically tailored meals. Through North Carolina's Healthy Opportunities pilot and their 1115 waiver, they're getting $650 million to spend on a variety of different social service interventions, and food and nutrition is one of those categories. We know that the work that the food banks do is extraordinarily valuable, and we know that they're also under-resourced. We also know that if you address underlying food needs, that you're likely to save money in the health system in the long run. So I think it's important to look at the major sources of funding, look at the policy toolkit and what you're able to do through waivers and program flexibility with CMS, and create those new sustainable funding streams that are providing needed support to community-based organizations. And then over time, given a lot of the really smart foundational work that the state has done through the Virginia Data Trust, to be able to measure the impact over time of these interventions on health outcomes, on things like chronic disease. Once you prove the case there, then I think that you won't face much more opposition to addressing that as a basic human need, and make sure that the funding is flowing where it's needed.
Thank you, Eric.
Sure, I just wanted to add a bit about what Medicaid and our MCOs are currently doing. And so, as has been mentioned, Virginia Medicaid, like other states, is currently assessing food need along with a number of other social determinants of health through regular screening of Medicaid members. And then that data informs a holistic approach by our MCOs with their care management strategies. So just highlighting a few examples, United currently has a program called Breadbasket that allows their care coordinators to send groceries to members who are experiencing food insecurity and who can't access nutritious foods in their communities. And they also have a grant that provides nonprofits with funding to address social determinants of health. And some of those grantees include Virginia Fresh Match and Capital Area Food Bank. And then Anthem is providing members with online fitness and exercise classes and newsletters and information about nutrition, weight management, and improved self-care, along with affording members baby food vouchers to moms and of newborns during their pediatric visits for up to $30. They also have instituted a home delivered meal program for members on discharge from the hospital who are temporarily homebound. And they provide transportation for trips to the grocery store, churches, farmers markets. And so I think we have a lot of knowledge and information, lessons learned that could be leveraged to further explore additional opportunities to bake this into our Medicaid process. And to Kelly's point about silver linings from the pandemic, in large part, it has been a sandbox due to federal flexibilities. And both our SNAP team and our WIC teams are working with their federal partners to understand what should be continued over the long term. For WIC, definitely notice that the waivers for physical presence, meaning you don't have to be in person for certification or nutrition education, contributed to that 11% increase from 2020. And the same for SNAP, the broad-based categorical eligibility and flexibilities in that regard contributed to that 11% increase.
Wonderful. Thank you. Very exciting to hear about all of that. Even if people already knew, it's a great reminder of so much that's happening in the state. Kelly, did you want to chime in with anything?
I had one more comment about that short-term and long-term budget priorities. I think it's key, and I know there are some advocates here today, to leverage our data and link to current public policy priorities. So we knew last year that a major priority of the General Assembly, especially money committee leaders, was to reduce readmissions and emergency department utilization. We were able to, sometimes that data doesn't have to come from Virginia. So we actually reached out to our friends at Unite Us, and we're able to borrow some data from NC Care 360 that showed that an e-referral platform could help achieve some of those goals. So I think it's important to make sure that we don't always limit ourselves to short-term Virginia data when we're wanting to achieve more long-term results.
Wonderful. Great. Thank you for chiming in with that. We could go on all afternoon, but we are getting close to the top of the hour. And so I want to ask just one lightning round question as we move towards a couple of minutes for any pressing questions from participants. So this is fun. You don't have to explain it. Just want you to share. And we'll go in reverse order. So Eric, we're going to start with you. And if you would, if you had a magic wand and could immediately pass or fund one initiative to improve our ability to address social determinants of health, what would it be? And it wouldn't have to be something new if you wanted to expand on something. Yep.
So now that the state is putting the infrastructure in place for statewide coordinated care network, what I think is needed most is a flexible funding stream that can be used to support health equity initiatives around the entire state. And resources can be targeted where there are populations that have disproportionate negative health impacts to areas that have inequities in terms of access to resources, or they could focus on major policy priorities that are areas of concern like maternal and child health. I think flexible funding that can support this aspiration of achieving a more equitable society is probably the way we could honor the lessons learned from the pandemic.
Thank you, Erica. Eric. Vanessa?
Sure. I think I would choose to invest in data, whatever infrastructure is needed for data integration. We have a lot of partners in this work, and that access to data, analysis of data, so that the data drives action can be a challenge. I think the data trust has been a huge step forward, but long-term funding and making sure all of our agencies have the infrastructure to get the data that we need and to analyze it so it contributes to our solutions.
Thank you. Kelly?
From the healthcare provider perspective I mentioned earlier, I think Z-code reimbursement would go a long way towards encouraging providers to dive in and be more engaged in their patients' social determinants and help us improve outcomes.
Wonderful. I'm just going to quickly check the chat, but so much valuable information coming from this panel. I really appreciate your time and your insights. There is a question around, can you please address the role transportation or the lack thereof plays in people's ability to access nutritious food? And I'm going to add on to that. And if there's any policies, state policy, that you would recommend to address that as well. Open to the panel.
Sure, happy to jump in. For sure, we know that transportation is a barrier to accessing healthcare, food, any resource. We have a number of lessons learned from COVID. So when folks have to isolate or quarantine, that's part of what our case investigators and contact tracers are assessing. Are you able to do that? Like if you have to quarantine for 14 days,
like who's going to help with your food? Do you need food delivery, or what assistance do you need? And so exploring opportunities, some of which you outlined through our current payment models, to make our support for transportation more robust, continuing to leverage the partnerships that we've built with Lyft and Uber out of our COVID experience to understand how this can be applied to chronic condition management over the long term, I think would be some interesting opportunities to continue to explore.
Great, thank you. Would anyone else care to chime in?
I'm not sure I have a solution yet, but I want to just comment that that question is particularly relevant in our rural communities. So those areas where folks live in areas where there isn't access to Lyft and Uber, where I work with one hospital system in Russell County where they said there's really one local transportation option. And when they're calling and saying our patient needs to get to their appointment, but they have three clients ahead of them who are not paying through various waivers, then they are deprioritized. So that's something we're working with. And so I think those are solutions that can happen at the local level, as well as obviously, as the Deputy Secretary Walker Harris said, payment reform as well.
Yeah, terrific.
Just building off what Kelly said, we've definitely seen in some of the rural areas where we have networks that transportation is a special challenge. And I think some of the innovations that we've seen in the healthcare system, especially around telemedicine, are starting to evolve to make sure that people's needs are still able to be met. I think it's also really important to create an any door approach to getting access to services, because there may be important community touch points that are different from a hospital or a clinic, but can still put you face to face with somebody who can help identify needs and get you into a system so that somebody is responsible for coordinating and tracking whether your needs are met.
Awesome. Thank you very much to all of our panelists, all three of you, Kelly, Vanessa, and Eric. I think you've given us so much to think about, not only this afternoon, but I think you've seeded some wonderful topics going forward to the summit that is scheduled for next year. So thank you. I really appreciate your being here. And I'm going to turn things back over to Eddie.
Thank you to our wonderful panel, all of our presenters, as well as our attendees. Thank you for participating in our virtual summit. I'll say as a quick addendum to the end of that, food banks and a lot of food access organizations since COVID have begun transforming their models to look at how we can better get food to people in need, as opposed to having them depend on transportation infrastructure. So more of that home delivery type of service hopefully is linking up with other services as well. And we'll continue to make progress on that front. So again, just the start of the conversation. I hope that got the wheels turning for a lot of you. April 19th and 20th, God willing, and the creeks don't rise, they like to say where I come from, we will be in person in Richmond for an in-person summit, and we'll have a lot more engagement, conversation, and be able to build upon what we heard today. Really encourage you to all go to feedva.org and check out our Roadmap to End Hunger update. There's a lot of good information there. There's also a new page that provides funding opportunities for anyone who, everyone's always looking for more money. And so that's a new resource that you can find there. And just hope everyone stays in touch and stays safe, and we'll talk to you soon. Have a great rest of your day.